Hi guys. So I don't know if I'm going to make this a whole series quite yet about borderline personality disorder, but because we know that personality disorders can sometimes be diagnosed in groups, um, there's a lot of overlap between many of them. The symptoms, the diagnostic criteria. Narcissistic personality disorder is marked by the grandiosity. That's what sets it apart from the other personality disorders. But it can also have features, or you can just have multiple personality disorders. Not multiple personality disorder, which is now dissociative identity disorder, but you can actually be diagnosed with multiple different personality disorders at the same time. But with that in mind, that you can have narcissistic personality disorder and another personality disorder, I wanted to visit the associated features supporting diagnosis under borderline personality disorder. Not the diagnostic criteria, but the features supporting. There's a whole lot of words in this paragraph, but physical and sexual abuse, neglect, hostile conflict, and early parental loss are more common in the childhood histories of those with borderline personality disorder. Borderline personality disorder also frequently occurs with other personality disorders. So even though it doesn't specifically say under narcissistic personality disorder that there's a history of trauma, in the borderline personality disorder when it does. Now, something kind of interesting to note is that the prevalence is about the same. I think it's about 5.9% in borderline and about 6-point-something% for narcissistic personality disorder. But borderline personality disorder is diagnosed predominantly in females. It's about 75% it's diagnosed in females. That's not to say men can't have borderline personality disorder. I have met some. But that is to say that I wonder if there is some, I don't know what the word I'm looking for, maybe sexism at play, where men's experiences or men's report of their own experiences are a little bit skewed, so that they might not be reporting a traumatic childhood or traumatic experiences in their childhood, where women are far more likely to identify them. And so perhaps trauma in childhood is also a foundation of narcissistic personality disorder, but we just kind of don't know it or address it quite yet. But we do know that narcissistic personality disorder and borderline personality disorder can actually happen at the same time in the same person. And borderline personality disorder has roots in childhood trauma. So do with that information as you will. I might do a little bit more on borderline personality disorder just because I really enjoy digging into diagnostic criteria and things like that. But I also kind of want to lighten things up a little bit. So we will see what I come up with next.